Okay, so this video is going to be over acidosis and alkalosis. And specifically, we'll do respiratory versus metabolic. And so you can have respiratory acidosis, metabolic acidosis. That would be when you're acidic. And you can have respiratory and metabolic alkalosis. I'll also, for those that are going into nursing, I'll translate this also into something called arterial blood gases, or they're called ABGs. If you have markers, I'm going to use a couple of different colors. I'm going to use like a dark red, a light blue, a dark blue. Orange usually means pathology to me. So first of all, I'm going to start with black because I want to talk about, we're going to have two different types of breathing. So we're going to have hypoventilation. And that means decreased breathing. Hypo means below, ventilation means getting air into your lungs. We'll also do hyperventilation. And the reason this is important is because sometimes people think hyperventilation is rapid, quick breathing, but hyperventilation is actually rapid, deep breathing. You're really getting a lot of breath in and out. So what we want to do here is we want to extend this into how this is going to change CO2 levels, pH levels, bicarb levels. How can it begin? Can it begin with the respiratory system? Yeah. Can it begin with something else and then the respiratory system tries to solve it? You'll see in a minute, but I like to use one-way signs here. So I'm trying to make this a one-way sign. And you'll see in a minute. So if you're having trouble breathing, and we'll go over some different examples of that in a second here. But what this is going to do, well, if you can't breathe off your CO2, it's going to go up. And then it would be good to know this equation. It's just really important to know this equation, that CO2 plus water can make H2CO3. This is known as carbonic acid. We would have learned about this in the respiratory system as well. And then that can split and become acid. So this is acid plus bicarbonate, which is HCO3 negative. So this is supposed to say acid. This is supposed to say base. But technically what it is bicarbonate. Bicarb. The real take home from this is that you can see, and I don't know if I really want to draw it, but you can see here that these are going to be related. So if you have an increase in CO2, that's going to cause an increase in acid. Or if you have a decrease in CO2, that's going to cause a decrease in acid. So you want to think about those as always going together. If CO2 is up, then acid is up. And also, just because the pH scale is kind of confusing, I like to put it on here too. High acid means low pH. And then generally, if you have high acid, you're going to have low bicarb. And then we need another one-way sign. And again, this will become clear in a second. And then what that will do is cause an increase breathing rate. You're going to breathe faster. Now I'm going to switch to one color of red. I don't know, I like acid as red because that's what it is on the litmus paper. So these together mean acidosis. And leave a little space below this. This is going to cause acidosis. And acidosis in the body happens, it's one of the most narrowly controlled things. I mean, you're used to hearing about homeostasis in this class. Oh, I don't want an equal sign there. It's one of the most narrowly controlled things. pH of less than 7.35 is acidosis. if you get into that acidosis because of a respiratory problem, then it's called respiratory acidosis. So you can see that if, and we're going to give some examples here, but anything that affects breathing is going to raise acid. And since it begins with a breathing problem, that's respiratory acidosis. You can also get into this with a variety of metabolic causes. And technically, it's called a metabolic acidosis if the cause is anything other than breathing. So you might say, well, okay, give me some examples. I like to use orange for some reason for pathologies. The way you get bicarb in your body is you absorb it from your food. The kidneys can make it as well, but the main reason is you absorb it from your food. So if your food travels through you too fast, I always think about this as like the transporters in the kidney. They kind of have one speed, and if things go by too fast, they don't pick up enough, and if things go by too slow, then they pick up too much. It's the same thing here. And so if your food passes through you too fast, as in diarrhea, then you don't get enough chance to pick up the bicarb. The food goes through you too fast, and so you're going to get low bicarb. Same thing I mentioned, that the kidneys can make bicarb, but if you have renal disease, you're not going to be able to do that. Now that's going to be things that are going to be metabolic acidosis due to bicarb problems. Over here you can also have problems with acid. Now remember, we talked about before, or we'll also draw another diagram. There's another diagram. That if you have high potassium, it tends to go into cells, and then since the cell doesn't want to depolarize when this positive ion goes in, it will kick acid out. So now you have more acid in your blood, so that's going to raise acid. Hypercalcemia, there's another video about this, but albumin travels through the blood carrying both calcium and acid. And so if all of a sudden you add extra calcium and acid are competing for albumin in the blood. If you add calcium, it kicks the acid off the albumin, and so now you have more acid in the blood. Also, if you have diabetes and you're breaking down fats, it releases ketones, so you're not processing glucose the right way, so you're breaking down fats. That would also cause acidosis. Okay, so over here, how can you get respiratory acidosis? The first way is anything that impairs breathing. So any kind of respiratory disorder. And I like this because it shows that a theme in AMP2 is that the heart, the lungs, and the kidneys can really mess each other up. So here, the lungs are going to impair breathing, and that's going to drive up acid, and that's going to throw off potassium, and then that's going to affect action potentials in the heart and muscle in the brain. So here, the respiratory system is messing up with the electricity of the heart and the brain. Or also, the kidneys could be taking care of that acid. So things like, there's a number of examples, but let's do COPD, or COVID, let's do ARDS, acute respiratory distress syndrome. Narcotic overdose. So a lot of narcotics will slow down breathing. I know that most of us, when we think about alcohol poisoning, we think about they can vomit and then aspirate it. But alcohol also impairs the breathing centers, and so it slows down breathing. And then anything that causes rapid shallow breathing. And this one's tough because panic can often cause you to speed up your breathing, and then in response you psychologically slow down your breathing. So I like this YouTube channel, it's called Jim Can't Swim, and it's all about interrogation videos and stuff like that. And you'll see sometimes when these people that are suspected of crimes are stressed, they'll be breathing really shallowly and fast, and then sometimes they'll switch over to really rapid and deep breathing. Okay, so that's the top of this. I might, and hopefully I don't mess you up too much, but I might give myself a little more room here. Okay, so hyperventilation. Again, we're going to do a one-way sign. Sorry, it might help if I have a color picked. Hyperventilation, again, we need a one-way sign. And you can see now that the reason you need a one-way sign is if you have high acid, you can't go back to hyperventilate. You don't decrease your breathing with high acid. You have to go this way, which means if you have high acid, you increase your breathing rate. Well, if you take rapid deep breaths, that's going to decrease CO2, and that's going to cause a decrease in H+, and that's going to cause an increase in pH, and that's going to cause an increase in HCO3 negative. If we put in a one-way sign, and here's where, again, you want to think about this equation up here, is that if you have low acid, you're going to have low CO2. And if you have low CO2, CO2 is the will to breathe. You think about it as oxygen, like I need my oxygen, but no, CO2 is what actually drives your breathing. You can respond to oxygen, but it's a slower process. So what you're going to do here, if you have low CO2, is you're going to decrease your breathing rate. Again, I like blue colors here because this is right here. It's going to be called alkalosis. So this then is a pH of greater than 7.45. If the problem is caused by a problem with the lungs, and again, we'll cover some of those, then this is going to be respiratory alkalosis. And if the problem is caused by anything else technically, but generally it can be pH problem or bicarb problem, then this is called metabolic alkalosis. Things that can cause a decrease in bicarb, again, if diarrhea makes food go through too fast, so you don't pick up enough bicarb, then constipation. I mean, isn't this amazing how complex? I mean, normally there's plenty of homeostasis to solve this, but if you have a weak heart, if you have weak lungs, if you have weak kidneys, then the constipation can affect bicarb enough. Constipation can cause problems with the heart, the lungs, and the kidneys. Just like up here, hyperkalemia and hypercalcemia, those can affect acid levels. So again, in hypokalemia, potassium tends to come out of the cell, and then in order to not change the voltage, acid has to go into the cell. And so now if the acid is in the cell and not in the blood, then you don't have as much acid in your blood as you should. Same thing with hypocalcemia. Acid and calcium compete to balance negative charges on albumin. All of a sudden, if there's less calcium, then there'll be more space for hydrogen or hydrogen ions to bond to the albumin, which means there's going to be less hydrogen ions or acid in the blood. Things that can cause hyperventilation are things like altitude. So altitude, you're trying to gasp for air, and so that deep breathing causes you to get rid of your CO2. Tumors in the brainstem can cause you to all of a sudden start breathing more. So breathing centers are in your brainstem. And then another one is called psychoneurosis or a panic attack. Now, one of the difficulties with panic attack is you feel like you can't breathe. And so what do? You force yourself to breathe. to breathe deep. And so then what does that do? That causes hyperventilation. So you're going to have increased breathing. And then this mechanism is going to cause you to, again, decrease breathing. But then you feel like, I can't take a breath. And so you can see where it's kind of an ugly little cycle where you feel like, I can't breathe. So then you're like, take deep breaths. But then what that does is it hyperventilates you. But then this system, this mechanism says, no, decrease your respiratory rate, which leads you back to I can't breathe. So then the way out of this is then, of course, to rebreathe. CO2 is the solution. And you've seen it on TV, to rebreathe into a paper bag. Now some people, if I can get this moved over, some people remember this as ROAM. It's just a mnemonic that, and it stands for respiratory opposite. And what this means is if pH is high and CO2 is low, then those are opposites. And so this is respiratory. Or if pH is low and CO2 is high, then again it's respiratory. But here, up here, it would be respiratory alkalosis. And down here it will be respiratory acidosis. And then ME stands for metabolic, are equals. And so if pH is high, bicarb is high, they're both equal, then this is metabolic. Since the pH is high, it's going to be alkalosis. But if the pH is low and the HCO3 is low, then this is metabolic acidosis. So you're looking at pH versus CO2. If they're going in the opposite direction, pH is going up and CO2 is going down, then it's respiratory alkalosis since pH is high. If pH is down and CO2 is high, the pH is low, the CO2 is high, so that's respiratory acidosis because they're both, pH is going down, CO2 is going up, they're opposite. You can see that I don't really like this mnemonic, and in fact, it works for some, but I don't really like that mnemonic because I would rather just think it through. And what I mean by think it through is I think if you're going into nursing, and again, for this part of the class, if you're not going into nursing, I don't think you need to know this. But if you are going into nursing, and you can learn it now while you're learning the other pH stuff, then it's going to make it so much easier for you when you get to nursing. I think one of the hardest things in the first part of any kind of nursing course is electrolytes and pH. And so since we already kind of went over pH, it might be easier to learn this now. Because we're going to add another level to both pH and breathing. So pH, we'll put this right here. And then again, I like to use colors because acid on litmus scale, on litmus paper, is red. So here, this is going to be a pH of less than 7.35. And that's going to give us acidosis. If your pH is higher than 7.45, so greater than 7.45, then this is going to be alkalosis. But then defining whether it's respiratory is going to depend on CO2. It's going to depend on CO2 levels. And elements, maybe slightly different color of red. And if it's metabolic, it's going to depend on bicarbonate levels. So this is going to be due to a decreased bicarb, HCO3. Over here, alkalosis, it's going to depend on, respiratory is going to depend on CO2. So in this case, a low CO2, probably should have said that over here, that this is a high CO2. And slightly different blue. Over here, this is going to be metabolic if you have a high bicarb. So you can see that you got to worry about 3 levels. So over here, pH. Our scale is, over here we're going to put acidosis. And our scale is 7.35 to 7.45. Those are our limits. And so that's going to be alkalosis. We also care about CO2. So this was acidosis, alkalosis. This is going to be CO2. And CO2 is, the scale is going to be 35. That's a 35 to 45 millimeters of mercury. We measure gases in pressures. Well, if it's above 7.45, that's going to lead us to, and again, we kind of got to switch sides here, but high CO2 is going to be respiratory acidosis. And low, so less than 35, is going to be respiratory alkalosis. The other thing we care about is bicarb. Sorry, this is driving me nuts. I should have had this kind of over here. Okay, so with bicarb, our scale is 22 to 26. And again, we're going to express this as a gas. So these are often called arterial blood gases because these gases, CO2 is a gas in the blood. If you're lower than 22, so over here means lower, then this is going to lead to metabolic. Again, if the problem is bicarb, then it's metabolic. This is going to be metabolic acidosis. Again, not enough bicarb. If we're over here and we're above 26, then this is going to be metabolic alkalosis. So the extra complexity when you get to nursing is there's going to be 3 levels. There's going to be what's called uncompensated. It's going to be what's called partially compensated. And compensated. Uncompensated is when you have high CO2 higher than 45 millimeters of mercury. Now what the body's going to do to try and start to fix this is it's going to raise bicarb. It's gonna, the kidneys are going to keep bicarb, the kidneys are going to make bicarb, so we're going to increase bicarb to above 26 millimeters of mercury. But what makes it partially compensated is pH hasn't changed. And then what finally makes it compensated is if you have high CO2, high bicarb, and normal pH. So once we get the pH, we've gotten enough bicarb to get the pH to normal, then it's called compensated. Over here, it's going to be uncompensated if we have, sorry if you can hear my dog, HCO3 is going to be below 22 millimeters of mercury. Now what the body's going to do if you're in this case is it's going to try and lower CO2. You're going to breathe fast and try and get rid of the CO2. And so the CO2 will go less than 35 millimeters of mercury. But it's going to take a while for the pH to change. So if you have low bicarb, and then you're going to have high CO2 to offset it, and then pH is normal, now it's compensated. Over here, you're going to have low CO2. So low CO2 is going to be lower than 35 millimeters of mercury. What the body's going to try and do is it's going to try and get rid of bicarb. So it's going to lower bicarb. If you got less acid, you can get more balanced by getting rid of base. And so bicarb will go to less than 22 millimeters of mercury. But again, pH hasn't changed. So how you'd get rid of that bicarb is the kidneys would get rid of it. So now if you have low CO2, and then since you got rid of acid, let's get rid of base. So you've got low bicarb, but pH, now pH is normal. That's compensated. Over here, you have a high bicarb, sorry. So it's less than 26 millimeters of mercury. What the body's going to do is it's going to try and increase CO2. If you've got increased acid, let's try and increase base. It's going to increase CO2 to above 45 millimeters of mercury. But pH hasn't changed yet. So if you have low CO2, low bicarb, ran out of room, and pH is normal, now it's compensated. I used to do this a little bit different of a way, so I made this infographic a while back. I think it's probably still okay, and you can find a video on this. But what I like about this is I also on here am showing the graph that shows this, and I just want to add one more slight little layer to this, and that is acute versus chronic. I've always loved this graph because clearly you have to watch three things when you're watching acidosis, alkalosis, respiratory versus metabolic. Is you have to look at pH down here, you have to look at bicarb, but you also have to have in there CO2. So notice that this scale is CO2. These lines going through are CO2. So notice here that normal is the balance between CO2, HCO3, and pH. Well, if you get into these lower pHs, because you have really low bicarbs, then that's metabolic. If you get over here, because you have really high CO2, then it's respiratory. If you get over here, and it's because you have very high bicarb, then that's metabolic alkalosis. If you get over here and we have very low CO2, then that's respiratory alkalosis. But notice also there's a difference between chronic and acutes. Acutes are when it just begins, and the thing is the kidneys can take care of a lot of acidosis and alkalosis, but it takes 2 or 3 days for the kidneys to catch up. So that's a good one too. That's a good graph to help you show the difference between chronic and acute. Acute means you're going to have bigger swings in pH. So we're going further out on the pH scale, but once the kidneys can catch up, then the pH is going to come in. In acidosis, I'm not going to switch colors, I'm just going to draw it out quick. In acidosis, you're going to have high CO2. And what would you expect? So you'd have high CO2 because you have high acid. And what would you expect with high CO2? You'd expect rapid breathing. So I just like for the sake of thinking things through, let's say you have a patient that is rapid breathing. But let's say that you have a patient or person that is breathing slow. They're not rapid breathing. Well, if they're supposed to be breathing rapidly, and they are breathing rapidly, it means respiratory is right, is correct, and metabolic is wrong. So this is metabolic acidosis. Again, acidosis because the pH is low. If we're supposed to be breathing rapidly but we're breathing slow, then that means respiratory is wrong. Respiratory is doing the wrong thing. And so that means this is respiratory acidosis. Over here, if you have alkalosis, then what you have is low H, which means you have low CO2, which means you should be breathing slow. And you can have a patient that is rapidly breathing, or you can have a patient that's breathing slow. Well, if they're supposed to be breathing slow and they're rapidly breathing, then respiratory is wrong. And so this is going to be respiratory alkalosis because the pH is low. Over here, if the patient is breathing slow and they're supposed to be breathing slow, then respiratory is correct. So that means it must be metabolic is wrong. So this is metabolic alkalosis. And kind of going back to the Rome and kind of just hitting that. Because again, if you have a patient that has high acid, high CO2, and they're breathing slow, then it's respiratory, because you're not supposed to be breathing slow with high acid. You're supposed to be breathing fast. So if you have high acid and you're breathing slow, then that's respiratory. If you have high acid, high CO2, and you are increasing your breathing rate to get rid of that CO2, then the respiratory system is messing up. And so that's metabolic acidosis. Over here, if you have low acid, you should have low CO2. So you should be breathing slow. But if you're hyperventilating, then this is respiratory alkalosis. With low acid, you should have low CO2, which means you should be breathing slow. And if you are breathing slow, so low acid, low breathing rate, then it's metabolic. All right, thank you.